Hi, good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, November 17th, and this is, of course, your opportunity to get your COVID questions answered. You can put your questions directly into the box below on Facebook. You can also hashtag them on Facebook or Twitter with the hashtag AskDrArwady. So, as always, we will be taking live questions as they come in. We've also had questions submitted to us over the last few days, and I'm by myself today, so we'll try to get through as many questions as we can. Let's go ahead and take a quick look at our data. As always, you can go to chi.gov/COVID- or chicago.gov/coronavirus, and right up at the top, the latest data tab. We continue to add things to this latest data tab. As you can see here, we've got a daily outbreak summary, hospital capacity, reopening metrics, details about community outbreaks, details about testing data, our mobility report, the data portal where you can download the data yourself if you want to explore it, and then presentations. Whether we're giving them at press conferences or in any public setting. So lots of data to explore, but right up at the top, of course, is the daily dashboard. And if we pull this up here, we continue to see numbers not heading the way we need them to head in Chicago. We'll start with that positivity right up at the top. Test positivity is now up to 16% in Chicago, with no sign yet of that slowing down. Just last week, we were at 12.9%, so that's going up quickly. That's what this graph is here on the right. You can see the positivity just continues to uptrend. And that's despite the fact that we are breaking records almost every day for testing. Our 7-day testing average is up near 16,000. It actually popped over 16,000 yesterday. We've done almost 1.7 million tests here in Chicago. And although this has been increasing, that's what this graph is, you can see, it is not keeping up because the positivity is still rising. And the positivity is the number of positive tests divided by all the tests that's done. And so if this were just being driven by an increase in testing, you would see that test positivity come down, whereas unfortunately it's still increasing. And then our case count. We're up to cumulatively 135,000 Chicagoans that have been diagnosed with COVID, and our daily average is at almost 2,300 per day. You can see that's up 31% just from a week ago. And if we look at the daily by demographic information, this is where you can break down and see what the graphs are looking like. You can see how quickly this is just continuing to increase in terms of cases. We're averaging 7 deaths a day. That's been in the 7 to 9 deaths per day range for the last week or so, up from 2 to 3 over the summer. So I encourage you to continue to explore this. On the weekly by zip is where you can look and see more details about last week. This is where you can look by zip code and see how many people were diagnosed with COVID in your zip code last week, what the positivity was in your zip code, how many deaths in your zip code, and explore more of that over time. We also see what share of the population in different zip codes have been diagnosed with COVID, and there's more you can explore. So I encourage you to do some of that yourself. I also thought I would point out quickly here in our daily summary, this tab is where we're putting a lot of the daily updates. So you can see here, this is our tests in gray compared to our positivity in blue, with more explanation about what goes into those. Here's what our case numbers look like day over day. Here's the breakdown of what our cases have looked like overall. So from the beginning here, you can see about 9% of our cases have been in kids 0 to 17, about 24% in people 18 to 29, and so on and so forth. You can see data about severe outcomes, and you can see data about hospital capacity. So just giving you a sense, there's a lot of information. Under community outbreaks here, this is where we're updating data, talking about where are we seeing outbreaks, meaning more than 5 cases associated with a facility, long-term care, congregate living, daycare or school, other community. You can see data about public places that people have visited, which doesn't mean that's where they've gotten COVID. It's just where they report that they have spent time in the 2 weeks prior to being diagnosed with COVID. You can see where people are reporting in clusters and cases. You can see confirmed COVID deaths associated with an outbreak. About 38% of our deaths here in Chicago have been associated with an outbreak, meaning with a place where there has been spread of COVID. And most of those have been, as we know, long-term care facilities, nursing homes. So about 93% of our deaths associated with an outbreak have been at these long-term care facilities. But most of our deaths have not been associated with outbreaks. They've been just people in the community. We've also got more data in here about increases we're seeing in youth settings, schools and daycares. That's not because schools and daycares are significant sources of transmission within them typically, but because we see more cases in the community, more cases are then coming into those settings, just as we are seeing in every other setting. You can look and see more of that data, understand how child and staff breakdown looks like, just continue to explore. This is looking at our youth cases reported week over week, and you can see in red are the pediatric cases associated with a facility, a daycare, a school, and you can see they remain a very small proportion of the pediatric cases that we see overall, and that increase is largely being driven by the general increase in the community. And then if we pull this down even further, the darkest blue here are our pediatric cases, and you can see they've really been growing in proportion to what we've been seeing across the city. So I encourage you, there's a lot of data on here, and part of the reason I went through this is that a good number of the questions that came in over the weekend can actually be answered by doing some more exploring online. So, okay, let's go ahead and turn directly to questions. Okay. Lots of things coming in already. Okay. Let's start with Marianne Misal Hidalgo on Facebook. Do COVID and the flu have the same symptoms? How do we know whether it's COVID or the flu? And I see a couple other questions related to flu. So the bottom line is there is no way to know for sure whether your symptoms are COVID-19 or the flu or even some other respiratory disease without getting a test. That's because a lot of the ways that COVID-19 and flu present are similar. People present with fever, people present with cough, sore throat, congestion. We often think people who have the flu often have really significant muscle aches. We talk colloquially about people, if they get really sick with flu, feeling like they got hit by a truck, this idea that you're just getting run over and you're feeling this whole body ache. But we know people with COVID, particularly if they're having a more significant infection, can also have that same feeling. I'd say in terms of differentiating, one of the things that has been unusual about COVID-19 is this symptom that many people report, feeling of losing their taste or their smell. That seems to be quite specific to COVID. So I'd say if you're feeling like you're losing your taste or your smell, chances are very good that it's COVID, but we have plenty of people who have COVID who don't have the feeling of losing their taste or smell. The bottom line is that you do need to get a test to know the difference. And there are, as you know, testing available for both of those. I would just say, because there's a couple other questions here about, how bad is flu compared to COVID, just to help put this in some perspective for you. One of the biggest differences between flu and COVID has to do with its mortality, meaning how likely is it that someone is going to die with COVID versus the flu. And unfortunately, COVID has about a 10 times mortality rate of what the flu is, give or take. We're still learning, obviously. As we know, there are more people infected with COVID with asymptomatic infections, but that was an estimate early on, and it's not shown to be particularly different. Even if you take, for example, the number of U.S. residents that have died from COVID, people who die from COVID, this is less impacted by changes in testing, et cetera. These are people who get seriously ill and then die. We've had, at this point, about 220,000 people die just in the United States from COVID this year. And if you look back last flu season, the 2019 to 2020 flu season, we had about 22,000 Americans die from the flu. So already about 10 times as many Americans have died from COVID as died from the flu last year. We when we think about the number of people who have been infected and diagnosed, there were many more Americans diagnosed with flu last year, estimated around 38 million. We've had about 10 million diagnosed, excuse me, with COVID this year. But again, we know there are a lot of people not necessarily getting tested and diagnosed formally if they but they may have COVID, just more mild symptoms. But regardless, we seem to see more people with serious outcomes from COVID. We've also seen more blood clots, problems with strokes, problems with the vascular system, the blood system in COVID. That's not a common complication with flu. We've seen this multi-inflammatory syndrome in children with COVID. That doesn't seem to be something similar with flu. And then some of the other big differences, of course, is that there is a flu vaccine available and there is not yet a COVID vaccine available. So that one's more easy to prevent or help limit the severe impacts of. And then treatment-wise, we have antivirals for flu. So when someone has been diagnosed with flu, particularly very early on, they can take a Tamiflu or one of the other approved antivirals, and it can be quite protective in terms of making somebody less likely to be hospitalized or have a severe outcome. We're still very much working on treatments and medications for people with COVID. Remdesivir is still the only FDA-approved medication for COVID, although there are a number of others that are in the works. We definitely don't have anything similar to the Tamiflu. So thanks for that question and everybody else who is putting questions about the flu. Get your flu shot if you haven't, please. We know that people can be co-infected, can have flu and COVID at the same time. We have seen that, and that makes it harder because then you're dealing with two viruses at once. Okay, Jesse Mannon on Facebook is asking, can dogs transmit COVID? Is there a risk in sending dogs to daycare? So we continue to learn about animals and COVID. I'm not sure if people saw the news a couple weeks ago, but minks were noted in, I believe it was Sweden, to be an animal reservoir where minks were fairly easily able to be infected by humans, but then also able to transmit back to humans. When we see true animal reservoirs like that, obviously that's concerning in terms of being able to fully control the disease. Dogs, on the other hand, have been shown to be able to be infected with COVID, which is why if you have COVID or someone in your household has COVID, we recommend trying to have somebody else take care of the dog, feed the dog as much as possible. But dogs don't seem to get ill. At least it seems to be very uncommon, and they don't seem to transmit it by and large. So we don't see dogs transmitting back to humans. We don't see really dogs transmitting to other dogs particularly. Cats, from what we know, again, they definitely can get infected. We've had a few more case examples of cats getting sick, but they don't seem to get as seriously ill, and perhaps a little more transmission, but again, not a lot. Bottom line is it is safe for you to have your dog in daycare. I would just say if you yourself had COVID or somebody in the daycare has COVID, the safest thing would be to probably just not be sending your animals to any kind of daycare at that point. And just during the time period that someone is infectious, try to also think about not infecting the animals. All right, Perlene Davis on Facebook. If you have not been affected by the virus, should you take the vaccine, and how safe is the vaccine? All right, I love questions about vaccine. We actually have a press conference at 1 o'clock today where we're going to do our standard update for the week, and we are going to start talking a little bit more about vaccine in that press conference. But by and large, there is not yet an FDA-approved vaccine for COVID. We've been seeing some good news just over the last couple weeks from two different trials for two different vaccines, the Pfizer and the Moderna, both of which use similar technology, an mRNA technology. But those are interim. The trial is not yet done. One of the very few good things about how quickly COVID is spreading in the US and in Europe and around the world is it is actually making the vaccine trials go a little bit faster, because we have to wait for a certain number of people to get diagnosed with COVID to be able to know in the real world, is COVID effective or not. So Broadly, once there is a COVID vaccine that has been proven to be both safe and effective and it's been approved, we absolutely will be recommending that people get that vaccine, regardless of whether you have had COVID or not. But there will be much more coming about that, and it's a little bit premature at this point because we don't yet have a vaccine that is fully approved. So rest assured that nobody wants a vaccine approved that is not safe, first and foremost. The CDC doesn't want it, the health departments don't want it, the companies that are making the vaccine don't want it. There is literally no benefit to having a vaccine that is not safe and that is not effective. And so the processes that are being used to approve this vaccine are the same processes that have been used to make sure that all of our childhood vaccines, for example, are safe and effective. And although there's been work to speed this up around production, the fundamental portions to ensure safety and efficacy are in place. So we'll be able to share much more data about what we know about these vaccines, side effects, safety, once the trials are finished. Pam Petrowski on Facebook is asking, are all flu vaccines equal, or is there something special we should be looking for? So broadly, the CDC recommends, first and most important, you want to get a flu shot. There are sort of in different years, sometimes there are some higher dose vaccines that are available, especially for people who are older, over 65. And that's because people who are older can have slightly different immune responses. And these are some of the questions we're still learning about related to COVID. Also, there is a flu vaccine version that is given via a nasal spray instead of via a shot, and that is a good vaccine, but because the flu vaccine only contains, it does not contain any live vaccine. There's no possibility of getting flu from a vaccine. The nasal one has a very, very weakened version of the flu. And although it doesn't make you sick, it can't give you the flu. It's not recommended for people who have immune conditions, et cetera. So the bottom line is, wherever you go to get your flu shot, if you go to your doctor, if you go to a pharmacy, they will make the recommendation for the flu vaccine that is most appropriate for you. But the bottom line is you should get a flu vaccine. And the CDC strongly recommends, this is really for everybody over the age of 6 months with very few exceptions. You need to get a flu vaccine every year because the flu vaccine is made new every year based on the strains of flu that were circulating that year. And so the flu vaccine is not 100% protective against the flu, but it helps protect against the flu strains that have been most common. And importantly, it helps protect against the severe outcomes, the hospitalization and the death. Good question. Let's see. Perla Nunez on Facebook is asking, are there any cases or research of people being reinfected after previously having COVID-19? Yes, there have been individual cases of people being reinfected after having COVID-19. And we think this is rare, but it can happen. And where we know for sure that it's happened is where people have been tested for COVID-19 and their sample has been saved in a laboratory, and then they recover. They actually have negative tests for COVID. So we know that they've recovered and that the testing is not showing COVID in their body. And then they're retested later for COVID, found to be positive again, and we're able to get that actual sample and compare it in the laboratory to their earlier sample and see, is this the exact same COVID-19, or are there these very small changes, these little mutations, which are not scary mutations, but they show you that it's a slightly different strain of COVID, and it lets you know it's a true reinfection, meaning someone has been exposed again and gotten a slightly different version of COVID. So it can happen. We are still learning very much about how long after someone has had COVID, how long do we think that there is some level of protection against reinfection from COVID, but it is not complete, and we don't know how long it lasts. The CDC thinks probably for about 3 months there's some level, but especially in people who are having more mild infections or asymptomatic infections, there's still a lot of questions about this sort of natural immunity. And for me, the fact that we're seeing still, not just in Chicago, but in a number of cities across the U.S., a lot of the parts of our cities that have been hardest hit by COVID still, and again, are the ones being hardest hit from COVID. And it's interesting because you would expect, like in New York City, some of the areas that had just the highest rates of COVID from the beginning had very high serology and antibody levels, where you went in and checked, and it looked like, a very high percentage of this community had COVID and seemed like there would be some protection. The fact that some of those same community areas are where we're seeing COVID reemerging, to me, makes me a little bit concerned about how long some of that immunity lasts. So bottom line is that even if you've had COVID, we need you wearing a mask. We need you doing all the same protective things. The vaccine, we are very hopeful, will have a more predictable immune response, a more protective immune response. We'll need to follow people over, years to understand how long that protection is likely to last. But in these initial trials that have the intermediate data shows more than a 90% effectiveness protection against COVID, really, really good data, but we'll still be learning how long that lasts. All right. Kim Garati on Facebook is saying the Chicago antibody study done over the summer, I believe, showed about 17% of about 17% of Chicagoans had antibodies. After this surge, what percentage do you think will have antibodies? So this feeds a little bit into this conversation that we were just having. So broadly at this point, still about 3 to 4% of Chicagoans have been formally diagnosed with COVID. We estimate, as you've heard me say, 5 to 7 times that number of people have had COVID. And across the country, it's thought to be somewhere in the 5 to 10 times the level of people who have been diagnosed with COVID. Where we look at our mortality rates and some of our testing data and access to testing, we think we're more in the 5 to 7 times range. But that's where I've said, if you think 7 times that, yeah, that would be about already, 21, 22% probably of Chicagoans with some level of protection. And that has been similar where studies have been done. Now, different studies have been done on antibodies in different populations. So, for example, blood donors, they have been looking for COVID-19 antibodies across the country in people who have been donating blood and have seen wide ranges. Last I looked, across Illinois here, we were somewhere between 10 and 20% in terms of the percentage of those blood donors, but it was more in the 11-12% range. And there are some studies that have been looking and comparing zip codes. Again, we would expect some of the harder hit zip codes to have higher serology levels. But we are still learning what it means to have antibodies, to have serologies. And I really feel strongly that, we don't want to assume serology means I can't be infected again. It means that I don't have, potential risk for spreading. We're still very much learning about it. So I think, as this surge continues, yes, we are going to see many, many more people in Chicago infected. And the antibody studies are not just a one-time thing. There's a number of researchers that are looking at this in different populations. But where we are doing our analysis right now, you take the number of people who have COVID, you look at their infectious period, and then we estimate it's 5 to 7 times that many people in Chicago who have COVID at any given point. That's where these numbers come from, where right now in Chicago, around somewhere between 100,000, 150,000 Chicagoans have COVID right now, like infectious and spreading COVID. And that's where the estimates come from. If, at the upper edge of that range, that's 1 in 18 Chicagoans, like infectious right now, spreading COVID potentially. And so that's why, to your point, we will be seeing more people with antibodies, but we have not seen anywhere near yet this so-called herd immunity. And even in some of the parts of the country where honestly I would have thought we'd be seeing this some more, it's not so clear that this has been here. And so it's part of why the work on the vaccine is so important. That's the way that we will more safely get to true herd immunity. And that's why I've been so pleased to see the preliminary effectiveness and safety data on the earliest vaccine trials. So, Elena Levy on Facebook is asking, can you treat COVID, fever, and cough with Tylenol? Yes, you can. If you're having fever, if you're having cough, whether that's from COVID, whether that's from flu, you can absolutely use Tylenol in its prescribed doses to help treat that and feel better. I would just encourage you, if you're having fever and cough and you're not feeling well, please do make sure you're in touch with a doctor. I don't want you, if you're getting sick and really feeling worse, particularly if you start to feel like you're having trouble breathing, I want to make sure that you go in and get medical care. Go to the emergency room even if you need to. But if you're having mild symptoms, yes, Tylenol is safe to treat the signs and symptoms of COVID. Sarah Licky Dewan on Facebook. If someone was positive in the past and is negative now, can they still bring it into spaces they enter? Okay, so if someone was positive in the past and they've recovered, regardless actually of whether their test is negative, as long as it's been at least 10 days and their symptoms have resolved for the last 3 days of that, they are no longer at that point infectious and bringing it into spaces they enter. So where we talk about these up to 1 in 18 Chicagoans being sick right now with COVID, those are not the people who were sick in the past and recovered. Those are people who have COVID right now. If you had COVID in the past, we're not imminently worried about you spreading COVID from that infection, but the reason we want you wearing masks, doing all of the protective things, is that we don't know how long some of that protection may ask. And right now, I want everybody in Chicago to just act like you have COVID. Pretend like maybe you have COVID and you don't know it, meaning wear your mask whenever you're out, wash your hands, keep that social distance, and please, as a reminder, the stay-at-home advisory that we put out, you really need to be staying home as much as possible right now. You can go out for work, you can go out for school, you can go out for things that are essential, like getting groceries, getting medical care. But if there are things that are optional, please put it off right now. Also, as a reminder, we've got a question here. A number of questions sort of related to some of the stay-at-home advisory. Anna Dickey on Facebook is asking, what can people do that have anemia besides staying safe at home and doing everything you're telling us to do? If you're doing everything that I'm telling you to do, you're doing a great job. Broadly, it's just about limiting your exposure, and not specifically because of the anemia, but broadly for people who have any underlying conditions, any concerns, and even if you don't, like right now is the time to be trying to bend our curve here related to COVID, and that means not giving COVID opportunities to spread. So in addition to staying at home as much as you're able to, we really, really want people not to have folks over to their home right now, unless it's absolutely essential, like a home health care worker, necessary child care, necessary education. But if it's a social visit, now is not the time to be having a social visit. So I think it's for Anna here, just limiting right now, not forever, but right now, exposure to living, breathing human beings is your best way to keep your risk down and particularly try to keep your home as safe as it can be, which means not inviting people in who don't live there, and where people are going out, really doubling down on those basics. We know wearing masks, social distancing, hand washing, these things really do work. They make a huge difference. But where people let their guard down, that's often where we see spread. So Tiffany Hagstrom on Facebook, I understand why earlier when there were testing shortages, why we think 5 to 7 times more people have had COVID than diagnosed. But with testing available now, don't we think it might be less? Okay, so good question. One of the reasons we've put our Chicago estimate more on the 5 to 7 times range is because across the whole country, we think it's a 5 to 10 times range. And I do think we're on the lower end of that here, just based on what our testing numbers look like. But as positivity is going up, right, we also know that that is indirectly telling us that there are many, many more people who are not getting tested. And we know that there are people, lots of people probably, who have very mild symptoms or potentially even no or almost no symptoms who never go to get a test, not to mention the people who have symptoms and don't get a test. And so some of these have come from looking at hospitalization data and then death data. We've extrapolated backwards where, you know, here in Chicago, something like 2 to almost 3% of our people who have been diagnosed with COVID have died here in Chicago. That is higher than the mortality rate is for COVID. We know this from looking around the world, and we can use some of that to also estimate how many more people do we therefore think have COVID than have been infected. And then the person who asked about the antibody test, that's the other way we get at this. Like if there's been a good antibody study that suggested you know, a 20% positivity, and we've got 4% of Chicagoans who, for example, who have tested positive, we would know that's a 5 times the rate, basically, of people who have had COVID but not been infected. So I feel pretty good about that estimate in terms of our data here. We've had modelers and others looking at it. As testing continues to expand and grow, you're right that that may come down even a little bit further. But 5 times is really the lower limit of what we think that is across the country. Andy Pierce on Facebook, if I can smell the smoke or vape of the driver in front of me on the street or highway, could I be infected by COVID-19 at the same time? So the smoke or the vape itself does not carry the COVID per se, as we've talked about. I think broadly, if you're aware of somebody else's exhalation, right, it sort of makes you think about COVID differently. I don't know, Andy, if you're sort of in a car here, if you're on the street. If this is a vehicle that's passing by, that would be a very low risk generally. You're not spending 15 minutes sort of within the space with that person. Hopefully you have your mask on, and so, and hopefully, well, probably if they're smoking, they don't have their mask on. I guess that's part of it. But I would not have a high level of concern for sort of a vehicle that's in front of you or passing by you, assuming that you're keeping that distance. I think the cigarette smoke mostly just serves as a reminder to keep our distance broadly. But nothing specific about that would make me very concerned for a COVID infection. Andrea Ayala on Facebook is asking, can it be possible for tests to get mixed up due to the high amount of tests? Specifically if the person testing positive has not been out and has no symptoms. So there are a lot actually of things in place to make sure that tests are not mixed up. When you get a test, I'm not sure if you've had a test, but there's quite a lot of work to make sure that your registration is attached to, say, the barcode, for example, for that particular test. And then that barcode, you know, follows with the sample along to the lab. The COVID test, like any other medical test, there are a lot of requirements and safety checks to make sure the right person is getting the right results. So in the same way that, like, if you go to your doctor and you get a regular blood count drawn, for example, or blood work, your doctor's office is probably not the one actually doing that laboratory work. It gets sent out and then the results get sent back. It's the same system that we use for COVID tests. So I would not make an assumption at all that there has been a mix-up related to tests. We are using the same system broadly that we use to handle all the tests. I think You could imagine the potential for some human error. Say you're at a testing location and maybe it's a drive-through and you're testing 5 people in the car, and something potentially gets switched there right at the beginning. But we really do try hard, and there's a lot of protocols in place to make sure that the right person is getting the right test result. If you're getting a positive test, believe that positive test. Particularly here in Chicago right now, where there is so much COVID around, the chances are very good. It has a high positive predictive value, meaning a positive test is likely to be a true COVID infection. So please treat it as such and isolate. Arlene Stokes on Facebook: if you have had COVID, are you immune? So this is exactly getting back to this same conversation. What we know is that when people have had COVID and then have recovered from COVID, they have some level of antibodies, meaning there are some sort of immune cells that are in their body that say, I have seen COVID before and I have fought it before. But where we've been talking about the fact that it is possible, we don't think it's common, but it's possible for people to get reinfected with COVID, that says, no, it is not a definite that if you've had COVID, you're, quote, immune. And the other problem is we really don't know at this point if someone has had a natural infection with COVID, even if they have some level of protection, how long that lasts, right? So you cannot assume if you have had COVID, you are now immune. Even when a vaccine is available and we start doing that, that's a much more sure way to know what the response is going to be. It's less, it doesn't matter as much how sick you get, right? You usually have a higher immune response if you've been sicker with COVID. People who have very mild symptoms from COVID, we still don't know what that protection will be. So no, at this point, if you have had COVID, you are not considered immune to COVID. Based on everything we know now, people who have had COVID will not, for example, not need to get the vaccine to have that immunity. We will almost certainly be depending on that vaccine to really know that a person has true protection for COVID. Okay. Oh, we're just coming up on time here. Still a lot of questions. We'll try to get to some of these in the short answers here. I'll take maybe just as the last one, Jean Brooks on Facebook is asking, when a person is positive and passes 10 days without serious illness, when and how do we know they are negative to safely interact with people again? So when a person is positive and has passed their 10 days and they're feeling good, the last 3 days of that are good, they are safe to interact with people again. They do not even need to get that negative test. One of the good things about COVID is that once people have recovered from it, and it's been that 10 days, the research suggests people don't continue to spread it. You don't need a repeat test at the end of that time period, and you are cleared to safely interact with people again. Okay, thanks for everybody's questions today, and we will get to some more of them. We are back on Thursday with another live episode. In terms of good news, today is our 101st show, Facebook Live. We have been at this since before the first stay-at-home order, believe it or not. And I really appreciate so many of you who have been tuning in, getting your questions answered, and then importantly, helping share what we do know about COVID here in Chicago with your friends, your neighbors, and your family. As a reminder, the stay-at-home advisory here in Chicago did go into effect yesterday. Stay home, stay safe. You can go to chi.gov/protect to read more about the advisory. And that same link, chi.gov/protect, is where you can sign up to be part of Protect Chicago. We're setting up a lot of ways for people to be able to use texts and phone calls to make sure, even if you're sitting at home, you can volunteer to make sure other Chicagoans are getting the information they needed about COVID. There's also sort of a ground game work, which we could talk some more about. But check out that website and please do volunteer. The last piece of good news, and just as a reminder, is that the city did activate about $10 million of emergency support for our local restaurants and bars, which of course have been struggling along with many other businesses from the pandemic. Restaurants who already received state and federal assistance are still eligible for this additional city support. Applications for this relief close Monday at midnight, or at 11:59 p.m. Midnight. And so go to chicago.gov/hospitality fund if you're a restaurant, a bar, et cetera, to learn more and to apply. Especially if you know of a smaller restaurant in Chicago, please make sure they know about this. We want to do everything we can to try to help those businesses make it through this really difficult time. We will be back on Thursday to answer more of your questions. In the meantime, please double down on what works. Try to stay home as much as you can. I hope you're already having those conversations with your friends and relatives about canceling traditional Thanksgiving, and we will see you on Thursday. Be safe.